absentee rates are going up, so sickness rates are going up. That's sort of in line with the amount of COVID, I think, that's in the system. So we've got usually in the NHS, sickness rates run around 4 to 5%. Now they're near 8 or 9%, and they're creeping upwards.
And so you've done some modelling to look at how Omicron could affect that absentee rate in the future. And what have you found?
So we model different kinds of scenarios to help people make the best decisions that they can around the resources that they have. We know that there are increasing rates of sickness. We expect those increasing rates of sickness to go up, not only for this surge, but also well into next year because of the effects of things like issues with mental health and long COVID. And so what we do is we help people with different scenarios. So 40% we would hope would be a worst case scenario. But we are already working with organisations that are reporting around 25, 28% sickness.
How hard is it, though, to forecast, given that you're talking about a variant, Omicron, that has only recently been identified and all the data is so new and coming in all the time?
It's very difficult to do that kind of forecasting, which is why we model different scenarios. So we model, best case scenarios and worst case scenarios to help people make those decisions. But we do know that, we went into the pandemic with a massive workforce deficit in healthcare, almost 100,000 people and 50,000 registered nurses. And so I don't think it takes very much imagination to understand that a system that's already under a lot of pressure with an extremely high demand is going to have issues with meeting that demand in future.
Well, yes, and is it possible to say whether or not hospitalisations and the rise in the number of people going into hospital is going to have more of an impact on the NHS than staff shortages, or the other way around? Is it possible to make that assessment?
I think the two are interrelated, and also the focus is generally on hospitals, but also staff shortages are going to impact the community. So most care is actually delivered in the community in general practice and in areas like district nursing. And we know that those services are being quite profoundly affected. They are already running at a workforce deficit, and the latest surge is putting more pressure on those groups too.
What about the change in advice as far as self-isolation is concerned once somebody tests positive? That's been dropped in this country from 10 days to 7. That will make a real difference, won't it?
It makes a difference in terms of the availability of staff, but I think that's probably more in other sectors. A lot of the organisations that we're working with are choosing really to stick with the 10 days while they can, and I think that's really about helping to look after their workforce actually as much as anything.
That's so interesting, because we've also heard that in the US they're now changing their advice to drop the self-isolation days from 7 to 5 days. So do you think that even if that was even considered in this country, it might not be observed?
It's one of the things that's quite difficult to take out from the data at the moment is how many people are isolating due to being ill with COVID and how many people are in isolation because they've had a positive COVID test or an asymptomatic. Because that would have a big impact in terms of workforce. And because we can't really pull that data out at the moment, it makes it kind of difficult to say what the impact would be.
What do you think, or what are you hearing about the reaction within the NHS to the government's decision not to put in new restrictions, at least before the new year? They will say that they've looked at these studies which suggest that Omicron is less severe, that the chances of hospitalisation are up to 70% lower than previous variants. Do you think there is an understanding within the health service of that logic?
I think there is, but even a small percentage of a very big number is a very big number in terms of possible admissions. And we are seeing admissions going up. And we haven't even reached that peak yet. I think the workforce generally is in quite a dire state. Certainly anecdotally, a lot of the people that we speak to are absolutely exhausted. They've been through several waves of COVID now. And I think that generally it would be good if they felt a little bit more supported.
And by supported, what do you mean?
I think in terms of things like government policy, so, a lot of the issues that we see in terms of workforce in healthcare currently are long-standing government policies around things like investment in frontline services. Issues around PPE still do exist. We see that quite a lot, and I think your previous speaker was saying about how essential it is to recognise that COVID is airborne and that things like the guidance need to be updated in terms of PPE. The recognition of long COVID and how that impacts on the workforce. The ONS are reporting around 40,000 people are predicted to have long COVID in healthcare and social care. And that's not an insignificant amount of people.
What about the fact that we are getting the likes of Sir John Bell, who's been talking this morning, the government's life sciences advisor? He has said that Omicron is not the same disease that we were seeing a year ago. He's pointed out that people appear to be spending shorter amounts of time in hospital, even though hospitalisation rates are on the rise. Is that reassuring?
I think in some ways it's reassuring, but again, we have a system that was already under pressure before the pandemic. We've also got a system that has now very long waiting lists and issues with providing routine care, and therefore that's just going to put more pressure on the workforce. So any extra demand, even if it's much better than we hoped for, is going to put pressure on the workforce.